Gavels must be made in the United States.
Right, usually are. Okay, let's get started here. First up, Senate Bill 24, allowing students under the age 21 to taste wine in educational settings. All right, is there anybody in opposition to this bill? Well, that's a good start. Is there any need for an amendment to this bill?
SB
24. Okay. So the subcommittee is Petusek, Walsh, Post, Burrows, Sullivan, Spear, and Hunt. Okay. Who would like to make a motion? Would like to carry forward on this?
So moved.
Okay. Wait a minute. Did I say your name? He's not on the committee. Okay.
I'm not on the committee?
Not on the subcommittee. The subcommittee. This is subcommittee.
Oh.
Come on, Representative Sullivan, you must care about this. I want you to make the motion and it ought to pass. And
I will second it.
so Representative Petuzek seconds it. Okay. Any discussion on the motion of ought to pass? Seeing none. All those in favor, please raise your hand. 1, 2, 3, 4, 5, 6. Okay. And those opposed? Nobody here. 6-0. This is 24. Yep.
Okay. And then
Moving right along. Senate Bill 79, enabling the use of self-pour automated systems by the Liquor Commission licensees. Anybody in opposition to this bill today?
Going once.
You guys report, right? You're fine. Okay. Does any amendment necessary? Yes. Yes, it's something we're already doing. Yes, as I know full well. So, okay. Representative Sullivan, you.
Second.
Right. Okay, so, right. So all those in favor of the ought to pass motion, please raise your hand. 1, 2, 3, 4, 5, 6.
All set.
6 it. Okay. So far, so good. Well, yeah. We will get bogged down soon enough. Senate Bill 80. Consolidating licensing, auditing, enforcement responsibility for wholesale and retail e-cigarette sales under the Liquor Commission. Okay, is anybody in opposition to this bill? Speak never for more, hold your peace. Is there any
I have
need
a
for?
question.
Yes.
So my notes here is having this broken up between the two departments going to cost more? Like, is there a fiscal note that we're going to be getting out of this?
Well, not really, because what was be done before in terms of the role of Department of Revenue Administration is much like room and meals tax or not room and meals, because room you file it through the DRA. Like when I do my vacation rentals, I actually am filing it through the Department of Revenue Administration. And so I guess Ruined Meals is not there. Could they see that, right? Ruined Meals is through the DRA also. And But I do know the beer tax collection is done through the liquor commission. They'll do that. So it is, in this case, what was clearly obvious was people were not filing. Wholesalers were distributing it or getting into the state, and they weren't even bothering to report it. And so the DRA is really not designed to go chase money.
I see.
Whereas our liquor enforcement is obviously going to be in the lion's share of the establishments that sell these things anyways, because they also probably sell beer. So the fact that years and years ago, I mean, I'll say how long ago it was, because I was the one who wrote the amendment, but it was Donna Sitek was speaker. I'll tell you how long ago that was. So it was 30 plus years ago, where we moved it enforcement to the Liquor Commission. So it's really not a duplication. It's that it's a differentiation of responsibility.
Okay.
But I don't know if anybody else would like to talk about the cost or the management. But one thing we do know is that we get federal money for tobacco, and so that's what, Liquor Commission is the one who enforces it. So we sure hope the budget will fix that. No, it's all right.
Yeah, I got the fiscal note from DRA anyway.
Yeah, I just want to stop my phone from beeping at me. Okay, there we go. Okay. All right. I will make the motion. Seconded by Representative Patusek. Ought to pass. Any discussion on the motion? Seeing none, all those in favor, please raise your hand. 1, 2, 3, 4, 5, 6.
6.
Zip. Okay. Okay, Senate Bill 87. Okay, so as we discussed in the original public hearing, that two different chief enforcers brought this issue to me, and at the time, the focus was was certainly on salons. No one even talked about barbershops doing it, but I guess theoretically that could be true. I am acutely aware of, not that I've ever been there, but that whenever the ladies come back from getting the wedding dress,
Yeah.
that there was
Bridal
always
salons,
the
yes.
bridal salons, there was always discussion about champagne being served, and is one of those people who knows the law. The very first sentence in our state law says you cannot give away alcohol for free, let alone charge for it without being licensed. So in this case, we're saying is okay. Well, let's at least get these people to register. Pay a nominal fee of $100 and tell us, admit that they're giving away free. So the amendment, as you have in front of you, what I did was is what is the quantity of alcohol that can be served in the alcohol, and that they can't charge for it. It's got to be just free. If they want to charge for it, then they need to get a liquor license. So yes, Representative Spear.
Based on our discussion, this pretty much says exactly what we decided to do, so this is really good. And thank you for writing it.
Danielle did it. Not that I take pride of authorship, but yes, Representative Burrows.
I'm sorry. I'm just laughing because I know what my salon is like. It's like a party all the time. But the question is, who's going to enforce this, and are they really going to keep records of this? I mean, I know my salon, and I can't even imagine that they're going to be, they're going to be doing this about how much each patron is served.
I agree with you. I had thought about we should just remove the record keeping, but
And I hate to say it, but nobody's watching. They're gonna serve as much as they want to serve. That's you can have it in statute, but that ain't gonna happen.
But I think that where we need the statute, or where it works out, is if somebody starts to complain.
Yeah.
This way, there's something that's on the books in case there's a complaint. If there's no complaint, you're probably never gonna find out anything.
well, yeah, but this would be something. The one thing the liquor commission, when the liquor enforcement. Oh, see here,
Jeez.
the liquor enforcement would probably say, "Let's see your records. Let's see your papers."
Well, I'd be surprised if too many do it.
That's
At least we're making the effort.
so.
I agree.
I guess I was more interested in knowing what they were sharing, what they were serving. And then because we want to make sure that they're buying it at the state liquor store, right? Right. Well, I'm just saying. So did you guys ever look and see what other states are doing on this subject matter, or what are they ever? Records of the alcohol type, quantity, and I mean, do we really want to know each patron? When we want to know their name, and that seems sort of a.
Well,
How far do we have to go with this?
I think part of that stemmed from if we do have an issue and we do receive a complaint regarding an overservice or an incident or a minor being served, then the idea was at least we have some sort of record keeping that we can at least start with in terms of that. Where they're giving it away, normally we would have a receipt, a bar tab, something like that, that we would look at. But in this case, it's a free drink, they're giving it away. So it was some sort of record keeping to reconcile, the whole process.
So,
of what we're
assuming
trying
that
to
you're
do.
going to make some rules around this new statute, can we be understanding that at least that all you're doing is that they're required to have a book to sign in on?
Isn't that a violation of privacy?
No,
No?
it's a guest book.
You have no right to consume alcohol.
Yeah, there's no right. Nor do you have a right to drive a car, but we give those licenses
I don't.
away. Right. So, right. So something like along that line of just that you need to sign in and that you checked off that you're over 21 or something. Or,
Yeah, I
or
can
you
see
write
that.
your birthday down. You write your birthday. down.
No, that's a violation. I don't want anyone to know
Only
my
for
age.
women that they worry about their birthday.
I don't want anyone to know I'm 70.
Now everybody does.
Thank God for you too.
So just to clarify, the rule would be regarding the keeping of the records.
Right.
Like alcohol type,
Exactly. The
quantity, and
record
patron
record
served.
keeping. I'm assuming you're
Okay.
going to do an RSA along that. So what would you think? What would you guys think you would be doing for something like that?
And how long do you keep the records?
What? You want to hit the microphone?
There's
Right.
there's already statute that is going to require them to keep receipts for 60 days. The additional record keeping here is because these are free drinks, so there's no sale. So
Right. So there
license-
is no receipts. That's
Correct.
right.
That was the issue that was where the record keeping discussion came from here, is because we're not allowing them to charge for the alcohol, that it has to be a free drink. It was at least some sort of system, if there's a violation, if there's an issue, for us to start with.
there's no mention of how long to keep the records.
So that's
That
in
would be
a,
done by rules.
well, and that's already in statute.
But the interesting is that is, if I understand correctly, that is the receipts for the transaction that you're supposed to keep for 60 days.
Right.
So
which-
in this case, that doesn't go, we don't have any, but it does beg the question where I was going to go, which is, don't we want to make sure that they are actually, whether it's being delivered by the beer distributor
so that
or
that's-
whether the beer distributor would have
that's already in Title 13. So they're already going to be required to do that. So that covers all licensees in Title
right.
13.
And then whether if they buy it from a state liquor store.
Those are also the receipts that they would be required to keep for 60 days.
Okay, so
But
that's
those are all in other statutes in Title 13 that are once they become a licensee, then they're required to follow all those
Okay.
statutes.
so now we get back to the words that are here. To keep so basically we're talking about things that are already in current statute. Should we just make a reference to those things rather than just say keep records or?
Well, this is specific to the language in here is specific to the free alcohol they're giving away.
Okay.
The other record keeping is, as you explained, would have been specific if there was a sale or the alcohol that they've purchased
Right.
and where they
So we already
purchased
have all
alcohol.
that information.
Correct. But what we don't have, because there's no receipts, because a sale didn't occur, this was specific to the alcohol being given away. That's why this language was in there, because
Right.
it doesn't technically fall under the other statute.
So it's theoretically the only thing that's extreme here. Well, I guess personable and eventful information. Are we saying that we have to know what was served to the patron? In other words, what kind of alcohol type?
Right. So we could, meaning, did they get liquor? Did they get wine? Did they get beer?
Right. In other words, all we care about is who the patron was.
Mm-hmm.
We don't necessarily care about what they drink. Right. That's maybe a privacy issue about what they're actually drinking. We just the licensee will keep records. Well, there can't be quantity because the quantity is limited anyways. Of the patron served. In other words, so we just
Yeah, just the patrons.
if we cross out alcohol type and quantity.
Records is up to
Yes. You have
Good
something to
morning.
offer?
So, as most of these establishments operate, there's always going to be a list of appointments. So the list already is created. At the same time, if that alcohol correlates with that appointment list, then there's no reason to create a second list. If something goes sideways, we're going to gather that. Speaking of privacy, we'd gather that through a warrant.
Right.
Hold on. But
Yeah.
a lot of, I'm sorry, but a lot of those places take
Subcommittee,
people
you
up the
can, you
street.
can interrupt. Yeah.
I don't know where we are now.
Just go.
A lot of places take walk-ins, so they wouldn't appear in an appointment book. So I don't think you can count on that.
So we don't tell the licensee how they have to keep those records. So even right now, we have people who they have handwritten receipts. Some have very high-end point of sale systems. Some of them still use the carbon copy tabs that they write down. So in terms of this record keeping, how they keep that is up to them. If they want to do a separate ledger for the alcohol, they can. If they want to include it in their appointment book, they can do that. If they want to have it on yellow notebook paper, that's up to them. We don't dictate how they do it. We just tell them the information they're required to retain.
Yeah, so and where I am right now is that the licensee shall keep records of the patrons served. And I don't care what was served or how
Okay.
much, quantity should only be one, and I certainly don't want them to, get themselves in trouble because they did. Right. So just in that way, the patrons serve by having that name is then you have something to work from.
Sure.
No, yeah, we would draw a line through alcohol type and quantity.
Because no salon is going to refuse somebody who gives them a couple of $100 a pop.
Yeah,
Some are big tippers, right?
It's not even big ticker. I mean, the haircut, and it's real expensive now.
They are.
And they have, let's face it, a wealthy patron comes in, maybe she comes twice a month. That's a lot of money for them. And she wants more liquor, they're going to give it to her.
Yes, exactly.
And I'm going to throw a monkey wrench. And what are you laughing at? I'm just going to throw a monkey wrench, and I don't think we should do it today. But I was at a car dealership in Florida with my mom's car, and it was fancy. It was in Boca Raton, and they served alcohol. So aren't places like that going to want to do this too?
Deal with it when it comes up.
Yeah.
I think serving alcohol in a establishment where you're driving in and out of is maybe a little.
I only had 3.
It's almost as bad as having state liquor stores on the highway.
Good point. Good point.
So they single entrance interchange.
But yeah, so the statute's going to say barber, salon, and spa. Is that we were going to limit to those establishments?
This would be a sub paragraph of 178.21.
Okay. Oh, I see. Because you have to have a professional license as a barber or hair spa. Okay, so you
Correct.
have to have that license to
Correct.
get it.
Correct.
All right. Yeah.
So-
So they'll be back.
So how are we going to sort of initially enforce this? Are you guys going to go to like the barbershops that you hear of? Is going to be people calling in on our system?
Yeah, so I think eventually we would definitely first start with messaging. We'd probably have to pair with OPLC just to get the message out that they would be required. Much like we did with vaping, when vaping was unlicensed and then licensed, we gave them a pretty significant grace period in order to get into compliance and, do whatever they needed to do. And then from there, it would likely be complaint driven. They are subject to an annual premise inspection, whereas they just meet face to face with the investigator. We make sure they have everything they need. We make sure, if they have any questions that we answer those. But this has got some pretty significant bookmarkers on it where I don't see a need for heavy enforcement on this unless it's complaint driven.
Gotcha.
Representative Wells.
So if passed, will someone in government send every business that's got a license?
That's what she just said.
Okay, that's what I thought.
Professional license.
Yeah, right, to send them
and
a
work with them.
notification
So
that they have
anybody's
to do
got a
this.
license will get to be notified that this is a new business opportunity for them.
And like Danielle said, when we did this with vaping, they received a pretty substantial wide berth. And then also take into consideration the new point system. You have to have a similar or same violation pretty much almost 4 times before we're actually taking action. That's progressive discipline working out of education and warnings into an actual violation. So there's a substantial wide berth for somebody that's new in the business.
For the question? Yep.
I have a question. What happens if somebody gets to, during the grace period, even goes out and has a car accident after being served too much? What would happen to the salon?
If they're licensed, there would be an investigation into how that occurred, and there could be some prohibited sales penalty if they did that, just like any other establishment that it's serving or selling alcohol. Again, we would set some pretty, while we gave them a grace period, there's a deadline for that. So if it happened prior to that, there's not much we could do in terms of education and getting them in compliance if they once they are licensed. The other thing that we will do is because they're a new license, they'll be required to take a training. So we'll create a training. We provide this one will be specific to their type of license. The laws, liability, New Hampshire statutes that they would be responsible for. We push that out online. Again, this one would probably be online and limited in-person classes just because it would be a condensed training based on the license type that they have. We do that for several other licensees, retail tobacco, one-day licenses. We have specific trainings for them that's specific to their license type. Yep.
The rule of licensure.
That's right.
We, we only give licenses so we can take it away from you. Okay. So I have the only change is to delete alcohol type, quantity, and. Everybody feel comfortable with that? Obviously, we can't vote on this now because this is not an official amendment, so we'll have that drawn up for next week and get that taken care of. Okay. So let me keep my notes here on my cheat sheet. Okay. So 24 we ought to pass. 79 was ought to pass.
It would be OTPA, TPD, to be determined.
And 80 was ought to pass. 6-0.
Yeah.
So salon, we are going to need an amendment. And now we're down to
89.
89, enabling non-citizens who are legally authorized to work in the United States to deliver alcohol. Is there anybody in opposition to this bill? Okay. Is there any amendment needed for this bill? Is this another one of those things that is already happening? We're just making it legal. I guess we're turned into a rubber stamp committee. Huh? post activity. Maybe it was a pilot program, and now we can make it official. Okay, who would like to make the motion on this one? Representative Burrows moves ought to pass. Representative Putusek seconds the motion. Ought to pass. Okay, any discussion on the motion? Seeing none, all those in favor, raise your hand. 1, 2, 3, 4, 5, 6. Zip.
I like days like today.
Okay. OTP. 6 zip. Okay. That's it. And the only thing we need to worry about is well, I mean, in terms of the okay. All right.
We have one more bill at 1:15, yeah?
115, this is going to be the actual official hearing on the Senate bill, which, of course, all along we've been discussing its existence, but that this is the actual hearing on that bill. And then, of course, Carrie and I have to scurry over to the insurance department to continue our negotiations.
Now you're gonna do that?
So we will be doing that this afternoon.
Are we going to do very much with it, do you think? Because we're having that ambulance.
I would have to say, and I don't know if this is legal to have this conversation, but we're not even a.
Why don't you shut up your mic?
Yeah.
You, anybody above the
It varies from
Okay, we'll open up the public hearing on Senate Bill 245 and hear from the prime sponsor, Senator Prentice. Good afternoon, Senator.
Good afternoon, Chairman Hunt and members of House, Commerce, and Consumer Affairs. I hit the button that says, "Can I call you later?" Okay. Good afternoon. Which way do you want this? This way?
Yes, that's supposedly for the camera.
Yeah, that's exactly it. That's why I wanted to make sure you could see it. All right. Thank you, everyone. Again, for the record, my name is Sue Prentice, State Senator, District 5, representing 15 lovely communities in the larger Upper Valley, part of Sullivan County, and one town in Merrimack County. I am here today to introduce Senate Bill 245. This is the EMS No Surprises Act and No Surprises and System Stabilization Act. Much of this you've heard before. This is not new news. This is just the Senate version of it. And so I'm going to talk a little bit about this. Happy to take any questions that you might have. By way of background, I am a paramedic and I just recertified for my, it's now 30 years. So I'm feeling like a little bit old. But 30 years as a paramedic. I have been an ambulance administrator in the North Country, so I have a unique understanding of rural emergency medical services. And I'm formerly the chief of emergency medical services for the New Hampshire Department of Safety, working on the licensing and regulatory side of that. So what 245 does is two things. One, it's a protection for consumers. It prohibits balance billing. That's a direction that we definitely want to go in. But the second half of this is it protects emergency medical service units, because as we dial back balance billing, there is going to be a gap that needs to be filled, and we have to find a way to, what I believe is, share in how to fill that gap. Emergency medical services in the state of New Hampshire are community decisions, how they are delivered, whether it's by a fire department, a not-for-profit ambulance service, a commercial ambulance service, however they do it, whatever level of care, the communities make those decisions. So I just want to set that up as background. And when they make those decisions, they have to be thinking about, and I'm a former city councilor as well, so we worked on what does it cost our fire department to deliver this particular service? How do we cover that service with the rates, with a rate that will, again, cover the service, and we vote on those in public. It's an ordinance, at least in the city of Lebanon. But I wanted to offer that. Here's the next thing that I want to offer before I talk about the particulars of the bill. So we know that in healthcare, there is no more balance billing. There's a NSA across the board federally. The only thing they couldn't resolve was emergency medical services. So they set up, Congress asked CMS to set up a 15-person panel or committee, the Ground Ambulance Patient Billing Committee. We all affectionately called it GAPBAC. And that group worked over the course of a year and a half to examine all of the different complexities, because this is what Congress asks them to do, considering that in healthcare, we are like the one part that it could be volunteer, it could be career, and again, it's delivered different ways on the community level to examine all of those complexities. I was one of the 15 people that sat on that national group and wrote the recommendations, which have been submitted to Congress, but I can't promise you when Congress will act on those. But the work that I've put into 245 largely reflects what I expect, what I know has gone to Congress that I think is within our purview here in the state of New Hampshire. And it also puts us in a place, and we agreed on this as a committee, where we are deciding what the New Hampshire No Surprises Act is, what our work is going to be around balance billing, and the conditions to kind of what I say close that delta, and anything that Congress passes cannot supersede what we do. So far, 14 states have done their own work in this area. During that year and a half, we examined what each of these states had done in this area. So how they had closed that delta when they prohibited balance billing. So I wanted to lay that out in terms of background for you. So Senate Bill 245 says that if there, and I've amended this, and I'll talk about the amendments in response to testimony in the Senate, says that that for emergencies, so we're talking about 911 calls or unscheduled transfers, okay, that they will be covered at either the town set rate, and if no rate has been set at the town or city level, at 325% of Medicare. And I'm writing myself a note to talk to you about the 325 because that always comes up as a conversation, but we're going to get there. It also, so it qualifies this for the emergency piece. The second thing it does is it prohibits, and it says right in there, it prohibits ambulance services from balance billing. So they cannot bill the patient for what's left over. But there is, again, we're trying to close that delta. The original language that I had put in here also did cost sharing at, you couldn't charge more than $100. And it pointed to a clean claims provision, or it didn't point to the right clean claims provision of that the Department of Insurance has now since pointed out for me. And we have amended that language, and we have removed the cost sharing provision because that seemed to be controversial. And I just wanted to get at what the key points were right now for stabilizing the EMS system in our state. We know that the policy levers that we've pulled here in New Hampshire that have not been pulled before have been things like Medicaid finally being at a rate which is at 100% of Medicare for the first time in probably all the years that I've been here, and maybe all the years that many of you have been here as well. We hovered around 38% for a long time. Now, in order to improve the workforce and bring about stabilization, we got to 100%. We also pulled a policy lever on the Medicaid side only right now, because that's a place where we could for treat and no transport, where we have last year Senate Bill 409 asked the Department of Health and Human Services to submit an amendment to the state's Medicaid plan so that we could start billing for those non-transports. We're not doing that now. It's only for Medicaid. But the plan amendment has been submitted. It's important to note that through this process, two things. One, Medicare doesn't reimburse for this at all. Okay, they started a pilot program called ET3, which actually, there was at least one ambulance service in this state that was selected for this, but under COVID and all that was happening, they suspended that pilot. So we have no resolution with Medicare on treat and no transport. We did learn during the ambulance summits that the Department of Insurance has pulled together in conversations, even with folks here on Commerce and the insurance, some of our insurance carriers, that there is a code that folks can use for treat and no transport under some of the commercial carriers. It's just a matter of that's already there. It's not a policy lever we have to pull. We just have to get EMS into the place where that is something that they're going to be doing. We can only control what we can only control. So what I'm asking again is to prohibit balance billing to protect the consumers. I'm asking to help us stabilize the EMS system by agreeing on either town set rates, which are set in public, or 325% of Medicare. And as I wind down this conversation, my initial comments, I'm going to say two things. One is that 325% of Medicare didn't come out of the air. In looking at my work with the Ground Ambulance Patient Billing Committee, we visited, at that point, the 12 states. We're now up to 14 states. West Virginia just recently passed a similar provision, actually at 400% of Medicare. We looked at all of these states. We visited with all of the states that had done this work. We looked at because these are setting guardrails. We looked at what the Medicare reimbursement rate now is for ambulance services at the most commonly used, which is, the basic life support, which could still be an emergency call, and then factored in, like if we were at 325% of that, where would we be? This has become the nationally accepted rate. So I have moved in that direction to align with now the 6 other states that have done this. And the last thing that I'll say is there are communities that are closing ambulance services or considering closing ambulance services, Last December, I spent an evening in Warren, New Hampshire with former Senator Gaida and members of the leaders from the EMS community, as well as select board members and members of the public from not just Warren and Wentworth, but from Franconia, from Lincoln, from Woodstock, from Haverhill, because they're all facing the same under reimbursement. They've had chronic under reimbursement. They are not able to keep help anymore. They're having trouble just managing their emergency calls. So they are shifting. That's why I'm shifting this towards emergency. They're shifting everything over there to make sure the 911 calls get answered and the unscheduled transfers get responded to. But we still have this, we still have to pay attention, which is for another day on what we're going to do in building up adequacy for the non-emergency transfers. So those are some communities. We know that Best Care has closed, which was doing a number of the interfacility transfers. One of the most recent ambulance closures was actually in Berlin, New Hampshire. And some have heard, well, they were going to close anyway. No, the plan was that the fire department was going to take over the emergency calls. That plan has been in place for a while. But when they took over the emergency calls, the service that was handling what would have been the transfers, because you're not going to take the emergency ambulance and send it to Dartmouth or to Catholic Medical Center. They were still going to have this second entity, but they could not survive on where they were at for reimbursement. So they've actually closed their doors. And there was a day not too long ago where daughter of a patient that was in that emergency room put a post on Facebook and said, my mother has been in the emergency room for, it was at least a day. I don't want to, it could have been more than that, but it was at least a day. Is there any ambulance that can move her to where she needs to go? So with that said, I want to prohibit balance billing, come in line with that, get ahead of the federal trend. I want to stabilize the EMS system by providing a rate that I think is fair and has become really the national standard based on the work that I've done in this area. We face a serious threat. We know what it is, and even if we move towards a temporary measure, this is what we've got to do. I believe this is what we got to do. This is the Senate's position, and I'm here before you to ask you for your support, and I'm happy to answer any questions you might have, and if I can't, I'll get the answers for you. Thank you.
I have only one question because I'm a little confused.
How is that possible?
Because last week in our previous department meeting, and you said it today, so I'm just going to make sure I understand the situation. This is only emergencies.
I'm
This is
presenting
not
the bill.
transfers.
I'm presenting the bill as is, not any of the other conversations
No,
that
I
we're
understand
having. It's a
that.
great question.
No, but that's not my
No,
question.
but your question is about emergencies. It is, as written in the language, 911 calls or unscheduled
No, I got
transfers.
that. That's not my question.
Okay, then what is your question?
My question is, we keep talking about we're going to repeal balance billing.
Uh-huh.
Are we repealing balance billing for transfers and non-emergency? No, or not.
Not under this provision.
That's correct. So we haven't really gotten rid of balance billing. Balance billing still exists for transfers and non-emergencies with this bill.
Non-emergency transfers.
Non-emergency.
Emergency transfers, it would be repealed, and emergency calls, correct.
So I'm not confused.
You are not. That is correct.
Okay. Any other questions from any committee members? Thank you very much.
You're welcome. Thank you, Chairman Hunt.
Okay. Jerry Stringham. In support of the bill.
Thank you, Mr. Chair. I'm Jerry Stringham. I represent Grafton County 3, Lincoln, Woodstock, and Easton. I'm also a healthcare reimbursement consultant for the past 27 years, dealing with such things as fee schedules and particularly as relates to new medical technology, not ambulance services directly, but my life experience in this field brings me a perspective of how things work, particularly in the federal Medicaid and Medicare programs, how coding is linked to payments and so on. I support House passage of Senate Bill 245 as making significant progress in moving the system forward. It sets a reasonable rate based not just on other states' pen in the board, but actually the cost study that was performed that we heard about with House Bill 318, making reasonable adjustments based on some of the logic flaws that we talked about, including reducing the overall cost basis based on the amount of money cities and towns paid, handling the treat no transport, and a few other minor factors. I would say, as a reimbursement consultant who's been hired to perform studies very similar to this, I do think they did an excellent job based on the analysis they have and given the assumptions they were asked to work from. If I was asked to come up with a number to get us through the next 2 years and reduce the balanced billing exposure, I would have come up with 365% of Medicare as the rate to go forward with. I do support 325, and the EMS services and the ambulances are willing to walk away from their emergency stop, which is the balanced billing effect, with 325 in there. I think it's a good move for everybody to move forward. We'll certainly have issues to continue. I agree with you, Mr. Chair, that this isn't the end of the world on this thing. That we'll be back again. There's issues about whether we should have urban through super rural rates, and then whether the rates can be adjusted as treat no transport is able to be implemented in this as well. So, I think this will help our citizens greatly. I don't think people should be nervous when an ambulance service shows up at the door that they're going to be financially bankrupt. Overwhelmingly, this will do that, and it will not cripple the EMS services that are in great distress right now at the same time. So it does those two things. So let's go ahead and put this one on the floor and move forward with this. That's my recommendation. And I'll be happy to answer any questions that you might have.
I guess we're all set. Thank you. Chair will call on Michael Sitter.
Good afternoon, Representative Hunt and the rest of the committee. Thank you for hearing me today. I'll be brief because I know we have other work to do later this afternoon. But basically, my name is Michael Sitar. I represent the New Hampshire Association of Fire Chiefs, and I am currently the fire chief of the Tilton Northfield Fire District. And in regards to Senator Prentice, I've only been in EMS since 1979, So the New Hampshire Association of Fire Chiefs are in favor of SB 245. We're in favor of eliminating balanced billing. As long as we can get a reimbursement rate that helps reimburse us at 325. Fire departments, as we know it today, are not making a profit by billing or balance billing for our ambulance services. And any reimbursements that we get are just to offset the tax rate. We understand that we are supplementing Medicare, Medicaid currently, and we're also supplementing private insurance in many cases. And if we can get an appropriate reimbursement rate from at least the private insurance carriers, that's a little bit less off the taxpayers' backs. As you know, 325 is becoming more and more popular through many other states, and I think this is a good move and will be supported by the New Hampshire Association of Fire Chiefs. I'll keep it brief and happy to answer any questions.
Okay.
Thank you very much.
Thank you. I have one more card left. Paula Rogers.
Thank you, Mr. Chairman. Good afternoon, members of the Commerce Committee. For the record, my name is Paula Rogers, and I'm representing AHIP, America's Health Insurance Plans. And historically, you've heard on and off from the plans themselves. I'm not so sure they're otherwise occupied. Some may be in the room and ready to speak. I don't know. But I've given a lot of thought to what I could say today, and I thought, it's very hard to add something to a discussion which has been going on now since 2011 or 10. And I looked up the first year that the direct pay to the insured and the provider law was passed, and that was 2011. And then as I've listened to the testimony, it began to occur to me, in some ways, we moved to provide some facility for non-contracted ambulance providers to balance bill. And obviously, it became an important issue for them. And we're at a critical moment now where we're asking them to let go of balance billing. And there would be a balancing opportunity to have rate setting or a rate schedule for emergency services. And so insurers are now finding themselves in the awkward position of saying, we don't like rate schedules, we don't like rate setting. It's sort of anathema to our structure and our history. So it's a difficult conversation. So we want balance billing to disappear. And we have the challenge, as I said, with the rate setting. So I think it would be helpful for you to know that insurers, under the invitation and at the invitation of our regulator, and fire service folks, fire chiefs, and EMS workers have all had an opportunity to have pretty intense discussions over 2 afternoons and a third one coming up. And they're struggling right now with the same thing that the committee is struggling with. Well, where do we go with this? We've heard this lament from the providers. We hear the insurers giving you our institutional setting, which is hard to be sympathetic with, but it's a reality. And where is it going to ever sort of sort out? I was not around last session when the bill passed, 411, I think it was, Senate Bill 411, which set up the study. And of course, as you all know, the study published. Everybody worked earnestly to come up with a well-formulated study. And yes, there were certain conditions that were imposed in the bill upon some assumptions to be taken by the study. And perhaps those were weaknesses to the ultimate product. Plans came in when the study was sort of referenced in 316, and I think largely were neutral on the bill or sort of low-keyed on the bill because, again, the rate setting thing is anathema. But that's not going away. The rate setting thing is not going to disappear. It's going to be something that has to be dealt with. And maybe there's an opportunity for industry and the providers to get together and come up with something that will work in the short term, at least, because the insecurities around the study that was done still exist. And apparently under discussion is the opportunity to perhaps engage in another study 2 years down the road, a sunset, some sort of mid-range opportunity to address the immediacy of the issue. I'm glad I'm not making the decision, and I know that people with good minds are working on it, and hopefully they'll come up with something that people can say, we gave here, we gave there, it's not ideal, we didn't like this, we didn't like that, but this will be serviceable for the moment. So that is my sort of outside hope, I guess I should say. And this morning I was thinking about what am I going to say today that will make any sense, and I'm not sure that did, but it's sort of that situation where you say to yourself, if I hear what I happen to say, I may know what I believe. And so I just heard what I said, and I actually believe that the possibility is that something will be done. And if it doesn't get done, it will be back to you people as policymakers in your objective status, neither providers nor insurers, to figure out what to do, because it's not going to go away. So that's where AIP is, wishing for the best.
Thank you. Seeing no questions, or anybody else would like to testify? Seeing none, I will close the public hearing.
birthday, so.
My mother can. I tried to have my mother smoke. It didn't go well, but it's a different. You know, it's I got a flip phone, I got a smartphone, she could use, I got a flip phone. So,